If you're doing a canine, for instance, then the procedure is the same. Flip and then rotate so that it will be behind the canine. Your target tooth here is the canine, so it should be in the center, exact center. Okay, and then you ask, this is the canine, you ask your patient to stabilize on the holder. Okay, once it is stable, then again you bring your X-ray beam and just simply align it with the ring, and you take your X-ray. Of course, needless to say, your exposure time should be set beforehand. Your X-ray machine, of course, should be ready. We don't need to increase the time of the presence of the sensor holder inside the oral cavity. We need to be swift, quick, and effective at the same way. So you need to start your machine, put your lid apron, your infection control should all be done. Your exposure time is set, and there are machines, depends whether you're using the sensor or the wire type or the film. You need to change. There are some machines that let you choose between an analog film and the sensor. Of course, now in our school we're using the sensor, so it's almost fixed. So only what we need to do is that we start our machines, stabilize the patient, and take the X-ray. In all cases of doing a radiograph, this patient's head should be stabilized on the headrest to ensure that he will or she will not move during the X-ray. A comfortable patient means a cooperative patient. So please make sure that the X-ray, the head is stable, especially in the occipital protuberance should be stabilized or should be resting against the headrest, so that this patient's head should be stable. You can take your X-ray in different positions. Ideally, according to textbooks, your occlusal plane should be parallel to the floor, but you can do your X-rays regardless of the position of the patient, even in the supine position. One important thing when using these sensor holders is that you try to utilize always the use of a cutter roll. This will help the patient to bite on the block. See what happens if you want the upper incisors. Then you ask the patient to bite. You try always to place it this way. It will help the patient to stabilize the bite block. If you're using the lower teeth, I mean trying to radiograph the lower teeth, then try to put it on the opposite side. So the cutter roll is always placed on the opposite side. See, it helps the patient stabilize more, because sometimes this is a bit rocky, especially when there's saliva or blood, whatever.